Is there any news left, Matthew Holt? Stay tuned. It's the August 7th. We're so sorry we lost your news in the biggest digital health deal of the century episode of Health in 2.00. Here we are. And for anybody who wants to hear about Livongo and Teladoc, let us refer you to our all Teladoc Livongo episode that we put up yesterday, making sense of the deal. So Matthew, we have to talk about what has happened now.
Well, it was quite a day yesterday. The joke is that Livongo brought their earnings forward, and they had an amazing quarter. Of course, everyone forgot about that. You know, they had an amazing quarter. Their stock would probably have gone up even more other than they then announced the deal, and everyone sort of freaked out a bit about what Teladoc did.
Didn't you tweet something about somebody suing?
Yeah. I mean, some law firm is now going to sue Livongo for not getting enough. Not getting enough for the stock, which is the most mind-boggling thing. I mean, put it in perspective. If you want to get your cynical view of this, more cynical than mine, you go to His Talk, and Tim over at His Talk wrote a piece. He was asked about it, and he said, well, he put a lot of stuff in about how much all the executives are going to make and all this other good stuff. But in the end, what he said was, this company, which, may get to, if everything goes right, gets to like $1.2 billion in revenue next year, is now valued in the market cap, which is about nearly double, not quite, just a bit under double Cerner's. Cerner's at about $5.5 billion in revenue. So, the revenue number that they're going to get for this thing is insane in terms of the multiple. And actually, we'll discuss a bit more of that in the 2 minutes, I think, maybe. But
we'll start your timer.
But
if you want to hear the old guy break down that deal, though, go check out our other episode.
But apparently there was some other news, although I think most of it was held yesterday.
Oh my God, this is like the I'm so sorry to the following people.
Who we apologize on behalf of?
Oh, here you go. An apology to Ginger, your $50 million D round, which actually got announced today. So this brings our total up to $120 million. Hot company right now.
Yeah, they've been seem to be doing well. I mean, mental health space started out years and years ago with a kind of weird way of figuring out from your phone whether or not your use of your phone in the middle of the night meant you had some kind of mental health problem. Much more of a general counseling plus upgrade you to psychologists and then eventually upgrade you to psychiatrists if you need it. Working with a bunch of employers, I mentioned Sephora way back when, but also people like Kaiser. It seems to be doing well. Had some management changes a couple of years ago. One of the founders left. Russ, the new guy, seems to be pushing in the right direction.
Yep. How about Infermedica? This is an AI-enabled symptom checker platform that also does like patient routing. They're out of Poland. They get $10.25 million in an A.
Yeah, Peter Oswald's the CEO there. One of my favorites. They won EC to VC, which is the startup contest at Health 2.0 Europe a couple of years back. Really cool tool. And they're buried somewhere in Alexa if you ask for a symptom search. I think found out last year. And cool company. I like them a lot. They're competing, of course, with Babylon, Ada, and Boy Health and a bunch of others, and a Giant and a bunch of others in that space. So it's interesting. But that front door to the care is going to be interesting.
All right, Xealth. They get a partnership with Cerner, who also invests in them, $6 million along with LRVHealth.
Yeah, it's like another round onto their other round. They're on like $28 million now. Sort of, they raised quite a bit last year, I mean, 15 or something last year. This is a tool that puts in the middle of Epic, or now in the middle of Cerner, that puts like other stuff that you can prescribe, like digital health tools, like a Mark or whatever else. So interesting, cool company.
All right, what about SOC Telemed? They're going public as part of a SPAC deal. What does this all mean? And
it's like a reverse merger into a company that got funded already. They're an old world teleradiology. It's out of time. And they're interesting. They're the ones who said in their press release that their revenue is going to be their revenue, which is very related to not elective, but actual procedures in hospitals. It's actually going to go down this year because of the fewer admissions to hospitals. So I think it's doing things like remote radiology readings from smaller hospitals to bigger hospitals, that kind of stuff. Their revenue was in the mid-50s, and the investor in the deal was saying, well, we're getting them at like sort of 5 times revenue, and it's something like Livongo's or Teladoc's. So it's going to go up, we'll see.
I'm sure they were excited yesterday.
They're in the middle of a hospital system. It's not a brand new kind of market. But what it is showing is that there is appetite for anything that is going to sort of take from the human being standing next to a machine reading the readout to doing that remotely and putting it into sort of bunkers and all that continuous clinic stuff that I've been going on about. This has been a big deal in ICUs for a while, where people are setting up virtual ICUs off-site with doctors and others, and just looking at the stuff but not actually being on site and directing nurses and others to do what to do. And it's part of that trend. So this is kind of like the old world getting itself a bit more informated. It's not the new world that the sort of Teladoc Livongo thing has captured the imagination as being, whether or not that's what it really is.
Captured the imagination. Wow.
It's captured the imagination of like all the Robin Hood day traders until.
Oh my God! Well, didn't you say Accolade was up this today? Like they got a pound. Like.
Well, because Accolade, if you think about Accolade and even Infermedica and those front door, Accolade's real people doing concierge navigation. You got all these attempts to do it about AI. That's the bit at the very front end, right, of virtual care, which didn't have. Right now, if you call Teladoc, you get a human being. You sit in a queue, and eventually a human being comes on and tells you, yes, you've got a rash, and get on the CVS and pick up the script or whatever. The more and more you can stop even needing that expensive human being until you really need them, I think it's going to be a big deal. I would say not necessarily, my kids will be very used to talking to AI and getting all this simple stuff dealt with. Well, my kids already talk to Netflix and AI. They talk to Alexa the whole time, and I can't make Alexa not listen to them. So, but you get the idea, right? It's coming. And Accolade is kind of part of that. We talked about them, but yeah, their stock's bubbling up as well.
Interesting.
But by the way, talking about the stock market, which we've been doing a lot lately because everyone's sitting at home watching the screens rather than going out.
Well, now the two are merging, we're gonna be down back to one stock to look at.
But I mean, the overall stock market is very clear. The Nasdaq is way up, which is the big tech companies basically. But even the S&P 500 is like really close to where it was at the height in March. And you look around, we have no deal for the Senate for people with unemployment. We have no recovery deal in sight. We have 30 million unemployed. God knows how many people uninsured.
Oh my God.
I was in San Francisco yesterday wandering around. I had a chiropractor appointment. There's nobody there. So, the fact that the stock market is so insane because of all the funding and the money that's been pumped in.
Tech, baby, tech.
I mean, yeah, but it's still a wild world out there. And I think we're going to have a lot more uncertainty. And when you get to the election, because if Biden wins like it looks like he will, we're going to have more taxes. We're going to have more, more government spending and government regulation. It's just going to come, especially if they lose the Senate. The Senate Republicans lose the Senate, which looks likely. So, yeah, I think it's a wild world, and we're in for a wild few months.
Well, clearly you have a lot to say about this. And so those who are interested in hearing that should go and follow you on Twitter so I don't have to listen anymore. You can go to @VoltyBoy and find him. I'm not nearly as chatty on Twitter, but I'm there tweeting out the good stuff. I'm @JessDamasa. And of course, you can listen to other points of view and have them delivered directly into your inbox by hearing what our contributors to the Healthcare Blog have to say on our email newsletter. We curate the best stories and send those out. And we also put these Health in 2.0s in there and some WTF Health interviews and some other stuff. So sign up on healthcareblog.com. You really went off on a tangent there, fella. I think we should
Jess, hasn't the last 5 months, it hasn't just been one massive tangent?
I feel like if we were to go back and look at you in your 30s, we could probably find the origin of whatever tangent you were on from then and trace that to now if we really wanted to.
I can't remember that far back.
Oh my God. All right. That's it. We're done. Out. See you guys.